Please let's take note of these housekeeping announcements. We have washrooms to my right and to my left. The ones to my right are for ladies, and the ones to my right are for gentlemen. You realize that there is a door leading. A gentleman has entered that door right now. There are washrooms there for ladies, and we have some here for gentlemen. In case you are in need of anything, kindly contact our ushers who are dressed in white top and black gown with university souvenirs as tie and scarf. Thank you very much. Please, let's kindly rise for the academic procession. Thank you very much. Kindly resume your seats. Good evening, ladies and gentlemen. Good evening, ladies and gentlemen. On behalf of the management of this university, I welcome you all to this great citadel of learning. We are very happy you made it to join us as we celebrate Professor Tettey, the head of the Department of Surgery at the University of Ghana Medical School, College of Health Sciences. Prof. Tettey delivers the first of the inaugural lectures scheduled for the 2023-2024 academic year, and will be addressing the topic, the scourge of caustic burns to the throat, challenges of restoring a normal swallowing mechanism. I pray we all listen with rapt attention in order to take away tips relevant to our well-being. As we proceed, distinguished ladies and gentlemen, I'm privileged to welcome our registrar, Mrs. Emilia J. Mensah, to deliver welcome remarks and to introduce the chairperson for this very important meeting. Please join me and let's welcome her with a clap.
Thank you very much, Director of Public Affairs, Vice-Chancellor, other officials of the university, distinguished ladies and gentlemen, a very good evening to you all. I also take this opportunity to welcome you to this evening's inaugural lecture to be delivered by Professor Tettey of the Department of Surgery of the University of Ghana Medical School. As the director pointed out, this is the first inaugural lecture for this academic year, and I'm so glad that so many of you are able to make it here to join us here in the Great Hall for the lecture, and we also extend a warm welcome to those joining us online as well. Inaugural lectures form an essential part of the university's programs for each academic year, and every academic who rises to the rank of professor in their career at the University of Ghana is expected to deliver an inaugural lecture. This offers the university the opportunity to recognize and showcase the academic achievements of its faculty, and also enables scholars to share their research with colleagues within and outside the university, and also to celebrate this important personal milestone with family and friends. It is my distinct pleasure to introduce the chairperson for today's inaugural lecture. Our chairperson is the first female vice-chancellor of the University of Ghana. She's a professor of linguistics and an experienced university administrator, and she has over 20 years' experience in the higher education sector. She has built her experience in governance through attendance of formal management and leadership training programs, as well as on-the-job training. She brings a lot of innovation and resourcefulness to her position as Vice-Chancellor and is adept at change management. As Vice-Chancellor, she's leading the University of Ghana to uptake technology in all of its operations, while keeping the well-being of members of the university community in focus. She's a member of many prestigious societies and organizations, and is also a fellow of the Ghana Academy of Arts and Sciences. She's the founding president of the African Humanities Program. Ladies and gentlemen, please join me to welcome to the podium Professor Appiah Amfo, Vice-Chancellor of the University of Ghana and Chairperson for this evening's lecture.
Pro Vice-Chancellor for Research, Innovation and Development, Registrar, former officials of the university, Provost, deans, directors, heads of department, our distinguished lecturer, Professor Mark Mauto Tettey, faculty, staff, and members of convocation, alumni and students, family, friends, and associates of the lecturer, partners from the health sector, esteemed traditional rulers, eminent clergy, friends from the media, invited guests, distinguished ladies and gentlemen. Good evening to you all. It is exciting to be back here at the Great Hall for another hopefully stimulating lecture which puts the spotlight on the sustained scholarly works of one of our own from the University of Ghana Medical School Department of Surgery, Professor Mark Mauto Tettey. Through this inaugural lecture, the university also celebrates and recognizes his contribution to humanity as a trained cardiothoracic surgeon. Professor Tettey will deliver his inaugural lecture on the function of one of the body's organs that is very common to all of us, swallowing. I'm sure by now most, if not all of us, have swallowed food and water a number of times since morning. This function appears to be quite simple from the layman's perspective. However, from the medical point of view, it's a complex function which you often take for granted until there's a challenge that makes this function difficult or impossible. It is expected that when food is chewed, it would be swallowed almost automatically. In today's lecture, however, the lecturer will take us through one of the pathological conditions which severely disrupts the swallowing mechanism and at the same time threatens the airway. In this lecture, Professor Tettey explains one of the common causes of this condition, which occurs because of caustic ingestion, that is swallowing caustic soda. It is important to note that caustic injuries could be intentional due to suicidal intents, or they could be accidental. Accidental ingestion of caustic soda is common and a serious public health issue. Victims who accidentally swallow this substance are mostly children associated with people engaged in local soap production. It is unfortunate to note that out of negligence on the part of adults, innocent children are exposed to this rather unfortunate situation, destroying structures in the oral cavity, pharynx, larynx, and the esophagus. This results in long-term complications which may be suffered for life. In this lecture, Professor Mark Tettey will provide in-depth knowledge on caustic injuries, the different presentations, the devastating effect of complications of caustic ingestion, and different procedures currently used in the management of these complications. More importantly, he will share the innovative procedure developed at the National Cardiothoracic Center for the management of these cases. From the abstract, the lecture promises to be informative. If for nothing at all, I have already learned the scientific name for swallowing, which is deglutition. Distinguished ladies and gentlemen, with these brief remarks, I shall proceed to introduce our distinguished speaker for this evening's lecture. We have the full profile in the brochure. I see that we have hard copies, and it's also available electronically. So I will try to do an abridged version. Professor Mark Mauto Tettey is a cardiothoracic surgeon by training with over 20 years of experience. He completed and obtained his BSc Human Biology and MBCHP from the Kwame Nkrumah University of Science and Technology School of Medical Sciences. His training as a cardiothoracic surgeon has been mainly at the National Cardiothoracic Center, Kolebu Teaching Hospital, Accra. He qualified as a fellow of the West African College of Surgeons in 2002, having successfully passed the final part 2 of the West African College of Surgeons examination, cardiothoracic surgery. He was at the University of Pennsylvania Health System, Department of Surgery, Division of Cardiothoracic Surgery in 2005 for an observation training. He also trained in video-assisted thoracoscopic surgery at the University Teaching Hospital at Freiburg in Germany in 2007. Since his qualification, he has practiced as a cardiothoracic surgeon, and he was appointed in 2007 by the Ministry of Health as a consultant. His field of practice includes surgery for congenital heart diseases, surgery for acquired heart diseases both in children and adults, and vascular surgery and implantation of permanent cardiac pacemakers. In the area of thoracic surgery, he has done several cases of lung resections and esophageal surgeries, including chest wall resections and resections of mediastinal tumors. As a medical practitioner, Professor Mark Tettey has always been interested in researching into outcomes of pathological conditions that required surgical interventions. His current research interest is in finding solutions to a complex pathological problem, namely severe caustic pharyngoesophageal strictures. The solutions provided by him using innovative procedures are far-reaching and a breakthrough in patients with life-threatening severe caustic pharyngoesophageal injuries who have lost hope of ever going to be able to swallow again. He has delved into research projects in cardiology and has grants supports for these projects. He serves on the editorial board of the Health Services Investigative Journal and international editorial board of the Pan-African Medical Journal. Professor Mark Tettey has mentored and been involved in the training of more than 10 local and international cardiothoracic surgeons for the country and the sub-region. He is a principal supervisor for their fellowship dissertation. He is an examiner for the West African College of Surgeons and the Ghana College of Physicians and Surgeons. At the University of Ghana, Professor Mark Tettey has served on several boards and committees, too numerous to recount. Outside of the university, Professor Tettey also served on a number of boards and committees. And he's been the chairman of the local organizing committee to organize the first international scientific conference of the African Association of the Thoracic and Cardiovascular Surgeons. The African Association for Cardiovascular and Thoracic Surgery awarded Professor Mark Tettey with a plaque for his outstanding contribution to cardiothoracic surgery at the 13th annual conference in La Côte d'Ivoire. He is the head of Department of Surgery here at the University of Ghana Medical School and the acting director of the National Cardiothoracic Center, Kolebu Teaching Hospital. Professor Mark Tettey worships with the Global Evangelical Church Disciples Chapel. He is married to Dr. and Mrs. Clenam Jeffy Tettey, and they are blessed with a daughter, Salom. His hobbies are gardening and cooking. That's exciting, isn't it? So, ladies and gentlemen, believe it or not, this is the abridged version of his profile. And it is now my singular honor to invite Professor Mark Tettey to deliver his inaugural lecture on the topic, The Scourge of Caustic Burns to the Throat, challenges of restoring a normal swallowing mechanism. Thank you.
Madu aku Professor Tettey Mauto bayi do agu na jufiao jumagao jumasafo jumaviao university juaja plama pepo kata ba mi awezon lo Professor Tettey Mauto anya meka strong cho amagbato pa jiun ayo wo do cho jian anya meka afianwa mo ayo wo do ya pobla vo son posusu adange lashi afian le komi kuma university ayo ga afian le kolebu titi hospital ha ye pa dan plug ba wajeje webe West Africa to o miachie ayo po abotane le pa pe vraiment University of Pennsylvania to ho miachie le pa pe atome mavo University of Tettey aye o ga fianu amole Germany ha aja gbagba leke gbagbe le pa gbagba jeje we be Pan Africa to miachie ayo fianwa mo apo bo dudu po oji apo me ko nron agban la hananya jojo o ayo ro adan now Mavo, I matter of my house. After Africa, you call a bomb of war song. I jack back like a bugber. I got young you to call her. Prof, I go away the home. La University of Ghana ya. Ano bodo ayo no committee ome. Wo wodo ashila shima. Yeba do no sogba laka gbagba. Mi mate nga khlo ka tan o. Ala ba jiklo to maklo azan. To bi ngla du. Ne me mia jeba do no khla. An ku akarami lafia. Yeba gbagba jeje awe be. Fifia adon per hika blibo go do vakpe. Prof, away the home. Wagbaga jeje we be amagarozu doctor down. Eyo wagbaga jeje ga we be nyamaro mi la gbegba. Kuro adanunchi. Ma wuto na nya e ma we na nwonya tepe. Eyatai o chonko no be ma wutoro. Nyato na mara jivi egba na chonko ni banka ma wuto. Ama jada ngale ka gbegbe. Po ma fito fina mi lo. Na wa hiavi sro. Gbajino. Ovuvu ji abaya o kake. Ina chi hele mari. Yire prof gbo. Awo hemi de ji ya no. Aina Solomon, le groupe évangélique, principal chapel. Aye au clé à pono. Il gagne un clé nam. Jeffi. Tettey. Miina. Ma où ira mi clé en vie? Kaflalo. Donc ma où ira olo, magayi o hei. Prof, wagba jeje we be ebo dan ko rejio ba pa klasu ajagbagba leke gbegbe ntue na nya vava agbedo afio ba agbedo ego ba agbedo awo ma no mia mi ma tin apetara fio ajagbagba leke gbegbe ma una pochi abonu ma una kwota oklofu mo plus ba adanwi ochono wa na chana ma how Prof Magloya manyanyo ba aglede de George now ikamyo mi yona ba kwota egle yevu ba garden na adagleya nku yo kata na wo a adana ora magbeto pe no no mahu plus ba wa wodo chwa ji pla clan na mana no sesie kaka yo nyanya pudo dobu nanta awebe nyamate ganara jiwo ka gba ma haudi ania anyo ba na afianwumi ale na dana nwa kana ba magbeto no na nsema nyo ha mia vedelo aroma na namea mana namea hororio oh mi yo Tettey ba ma uto ya ma vo de ko aza so gbevo mi yo Tettey ma nya ma vo hela
Thank you. the Vice-Chancellor, Professor Appiah Amfo. May I please ask your permission to stand on the existing protocol? Thank you all for this opportunity this evening. The topic for my inaugural lecture, as was introduced already, is a scourge of caustic burns to the throat. The challenges of restoring a normal swallowing mechanism. The reason for choosing this topic is to drive home two key messages. One, caustic soda, which is responsible for 95% of the problem I'm going to be talking about this evening, is one of the key ingredients in the manufacture of soap locally by our unemployed mothers in the villages and towns. Now, this is a strong alkali and a deadly poison, but yet it is sold in the open market without any label. This should have been regulated to protect the vulnerable from being exposed to the devastating consequences of accidents occurring in its use. Innocent and unsuspecting children, sometimes adults, accidentally ingest this substance. Some of them perish, and others are maimed for life. In the developed world, they have actually banned the sale of this substance on the open market because they care for the vulnerable in their society. I think this should be a clarion call for stakeholders to do the needful. Now, my second message is this, that the worst form of the complications that occur in patients who survive injection of this substance is severe throat strictures or severe intractable pharyngoesophageal strictures. Now, the world is still struggling to settle on the best procedure that can fix these throat strictures without significant complications. But the good news is that the National Cardiothoracic Center, under my leadership, has come out with an innovative procedure that has the best outcome in the world in some selected cases. So, after my introduction, I will take you on a trip to the market. And from the market, you go to the house. From the house, you are going to the hospital, that's Kolebo Teaching Hospital. And there, I will just introduce you to the history of how this problem has been solved 100 years ago. And then, from the hospital, we'll walk straight to the National Cardiothoracic Center, where I will talk to you and then explain to you what I do. And then we may go to theater and I'll show you some pictures. I know that some of you are not very comfortable when it comes to hospital issues. The terms I'm going to use, you may not be so familiar with them, and the pictures, you may not be that comfortable with them. But then, just bear with me. The most important thing is the outcome. Outcome is so good, so excellent, that I'm sure you are going to celebrate that with me. And after that, I'm going to introduce a child who went through the same trip and is now doing excellently well, just to prove of what we have been doing at the National Cardiothoracic Center. And then I'll draw my conclusions. Now, I trained and worked at the National Cardiothoracic Center as a cardiothoracic surgeon for the past 25 years. And as a cardiothoracic surgeon, I operate on the heart, the lungs, the esophagus, and other minor structures in the heart, and also lesions of the chest wall. Now, the one who trained me is Professor Gobena Frimpong-Boateng. He was the first black man to have performed heart transplant surgery in Germany in 1985. If you don't know what that is, he is the first black man to remove a diseased heart from a human being and replace it with a healthier heart from a brain-dead person. It is not a small thing. This is the person who trained me. And he initiated and established the National Cardiothoracic Center in 1989. And as it stands now, this center is a center of excellence, offering services in cardiothoracic surgery, specifically adult cardiac surgery, pediatric cardiac surgery, thoracic surgery, and also cardiology services. The National Cardiothoracic Center is the only center that is accredited fully by the West African College of Surgeons to train cardiothoracic surgeons in the West African sub-region. And I must say that as at now, this center has trained 8 cardiothoracic surgeons from Ghana, and I'm one of them, and 15 cardiothoracic surgeons from Nigeria. Now, in the area of research, the center has produced more than 100 scientific papers or articles published in reputable peer-reviewed journals all over the world. I must say that the foundation laid by Professor Frimpong-Boateng is so solid, and I'll say that his legacy will remain for a very long, long time. Now, my inaugural lecture this evening will highlight the management of a complex complication of caustic injection, that is severe pharyngoesophageal stricture, that's severe throat stricture. Now, these are patients who cannot swallow. They can't even swallow their own saliva. Some of them cannot even breathe through their nose. They usually have this tube through the throat to be able to breathe. And most of them have this tube through the abdominal wall into the stomach for them to be able to feed. And this tube through the throat, we call it tracheostomy tube, and the one through the abdomen is a feeding gastrostomy tube. Now, surgical procedures to restore swallowing in this category of patients is an uphill task, and sometimes it's impossible. However, I would say that efforts and progress has been made locally and internationally, and this has yielded some significant results. Now, swallowing. Swallowing is a complex function. A lot of us take that for granted. But then, swallowing is a process that takes food from the mouth, through the throat, through the esophagus, to the stomach. Now, the esophagus plays a vital role when it comes to swallowing. Food transits through the pharynx, that's the throat, just in a fraction of a second. But it stays in the esophagus for about 2 to 3 seconds before the food reaches the stomach. And this behavior of swallowing is so important that it starts right within the womb. By the 15th week in utero, in the womb, the fetus starts this behavior of swallowing. Now, swallowing is divided into three phases. You have the oral phase, the pharyngeal phase, and the esophageal phase. The oral phase is voluntary. You have control over whatever is in your mouth to either swallow or bring it out. But once you swallow it, it becomes an involuntary action where you don't have control over it again. Then it transits through the pharynx and then to the esophagus, through the esophagus to the stomach. Now, the pharyngeal phase, that brief time, the fraction of the second, is the most complex of all the phases. Why do I say so? Because the pharynx, that short space, has a dual function. It's the same space as you sit down and you are breathing. It's the same space that commits the air you breathe to the windpipe or to the airway. And it's the same space when you swallow or eat something. It's the same space that will commit the food you eat to the esophagus. Now, if this function is disturbed, you swallow and the food will go the wrong way. That is why the pharyngeal phase is the most complex of all of them. And because of this complexity, we have over 30 nerves and muscles controlling the function in this space. Now, sometimes we lose control. For instance, if you are so much absorbed in some excited thoughts or maybe some worrying thoughts whilst you are eating, you just realize that you choke. And that's the reason why sometimes we advise our children when they are eating that don't talk whilst eating, because you can lose control and the food will go the wrong way. And that is not a pleasant thing. I'm sure most of us here have experienced some level of choking before. It's not a very pleasant thing at all. And I know that sometimes some people have died, some individuals have died from choking. And a lot of the times we think that it is the witches and the wizards that have controlled that kind of thing to choke and die just from eating. But then there are disease conditions that can also disturb the smooth coordination at the pharyngeal level. For example, stroke. Some patients with stroke cannot swallow because the stroke affects these muscles and nerves that controls the action at the level of the pharynx. Tumors at the pharynx, trauma and infections in this area can all disturb this swallowing, and that can cause choking. Now, throat burns from caustic injection can produce severe complications that disturb swallowing. Caustic injection, what does it do? It destroys the nerves. It destroys the muscles that are involved. It distorts the anatomy of the entire pharynx. So, but then what happens is the good thing is that most patients who ingest these caustic substances, they have lesions that escape the pharynx. The reason being that the transit of food within the pharyngeal space is so brief, a fraction of a second. So food does not really stay in that space to cause damage. So it's only about 0.6 to 24% of patients who will suffer or have injuries at the level of the pharynx after ingesting these caustic substances. When you take the statistics in the developed countries, most of these injuries are below 5%. But when you come to our area, where we expose the vulnerable to the high concentration of these caustic substances, the level of damage or the percentage of people who get this damage is more than 20%. In Ghana, for instance, our percentage is about 20 to 22% of patients who swallow caustic soda having damage at the level of the pharynx. So restoring the gastrointestinal or restoring swallowing in this category of patients is a huge challenge, because invariably when you attempt to do any reconstruction, it is complicated by aspiration, or that is choking. So the National Cardiothoracic Center, we started our research into this category of patients that had damage at the level of the pharynx in 2006, and we operated on a number of them, and we published our first series in 2011 in the Interactive Cardiovascular and Thoracic Surgery Journal. That's one of the official journals of the European Association of Cardiothoracic Surgery. Now, we concluded that in this African community, colopharyngoplasty provided an effective means of restoring an upper digestive tract continuity in patients with severe caustic pharyngospecial strictures. Tracheostomy in this setting portends a significant long-term mortality. What happened was we operated on 5 patients. 2 of them had tracheostomy, tube through the throat into the airway. And those 2 patients died from complications of the tracheostomy. That actually discouraged us or depressed us from the procedure we have commenced to do to help these unfortunate patients. But then we came up with an idea that, look, we need to come up with a procedure that would reduce or eliminate the use of tracheostomy in such patients, especially those who present with preserved airway. So one key factor that is very much responsible for the function of the pharynx is space. And this is compromised when they ingest caustic substances. So we came up with a working hypothesis that restoring pharyngeal space will reduce or eliminate aspiration during swallowing. Now, this is at the back of our mind. So that is what actually gave birth to the technique that I term colon flap augmentation pharyngoesophageoplasty. So let's look at this causative agent, the caustic substances. These are strong alkali and acids. Example of strong alkali is caustic soda that is used for the manufacture of soap. And then we have example of strong acid is battery acid. I'm sorry, this is my paramount chief, W3 the third of the Anglo State. Yes, so strong alkali, caustic soda, and the pH of this strong alkali is over 11.5, 12, thereabouts. And when you talk about strong acids, you're talking about battery acid, sulfuric acid, and the pH is below 2. Now, these caustic substances, they are highly corrosive and irritating. And they cause severe burns by reacting with the tissues. So the reaction is what brings about the burns. And this injection can be accidental or suicidal. And we see a lot more of accidental in the developing world and more suicidal in the developed world. And it's a common problem all over the world, especially in the developing world. Now, caustic soda, we all know, is used in the manufacture of soap, local soap, and one of the poverty alleviating programs for our unemployed mothers in the villages is a skill of soap and detergent making. But the big problem is these mothers separating the equipment for this industry from household utensils. That's the big problem. So they end up using household utensils as part of the industry. So at the end of the day, they end up keeping some of these dangerous substances in familiar containers, like cups, bowls, water bottles, mineral bottles, and the like. Meanwhile, caustic soda is colorless, is odorless, and tasteless. Very deceptive. And they end up, these children of these mothers, of friends of these children in the house, after playing for a while, when they feel thirsty, they just reach out for these containers, thinking that what is in them is water. They drink it before realizing that they've taken poison. Now, in the market, this is how the containers look like. They are imported in bags, in these yellow and blue plastic containers. And then they are packaged and sold like this one, just like salt and sugar. You would not know that this is a dangerous substance. And this is carried, in a market, and they just sell it around. Meanwhile, this is a dangerous substance. When it is dissolved in water and is kept in a water bottle, you cannot differentiate whether it is a solution of caustic soda or it's a normal water. So somehow I would say that if you know somebody who is engaged in this industry, and you visit them and they give you a bottle of water, you have to be very careful, because it might be something else. I'm just joking. Now, 95% of the complications we see at the National Cardiovascular Center is caused by caustic soda, accidental injection of caustic soda. Caustic soda, you just need a tablespoonful or 2 tablespoonfuls of the concentrated solution to cause havoc, to cause problem. The injury caused by caustic soda is described as liquefactive necrosis. It dissolves the issues as it destroys it. We can say it causes dissolution necrosis, and it's very terrible. And the chemical reactions that result or that give rise to this particular reaction is described as 1, saponification of fats, denaturation of proteins. We have emulsification of cellular membranes and thrombosis of the blood vessels. If all these things come together, it allows this caustic solution to penetrate the tissues. Within a second, it can cause full thickness burns. Those who understand this figure, this chest X-ray, this is a pneumopericardium after caustic injection. This is a 3-year-old child, some years back. 2 caustic soda solution, and the solution perforated the esophagus, and then perforated the covering of the heart. So we have leakage of air now accumulating around the heart. This child did not survive. Acids are rather loud. They are not as innocent as caustic soda. They have this pungent and irritating smell. So consumption is usually not accidental. It is most of the time suicidal. And the extent of damage is not as terrible as you have it with strong alkali. But when you take enough of it, it can also destroy tissues. Now, patients who survive the initial treatment of caustic injection with severe burns present with long-term complications of severe strictures of the GI tract. I must say that the complications are mostly in the esophagus. And these complications, the boys, let me just use the word, the boys can solve the complication at the level of the esophagus. But when it affects the throat, that one, you need a man to be able to solve that problem. And most of these children, most of these patients are children. We've collected some cases some years back, and we realized that most of them are below 10 years. And when you break it further, majority of them are below 5 years. Now, so let's look at the critical challenges. The critical challenges of a patient with severe throat stricture. What are the critical challenges? We have 2, structural damage and functional damage. Now, this structural damage affects the throat. It destroys the throat, distorts the throat, and even cause obliteration of the hypopharynx. And when you look at the airway, the structures above the vocal cord, that's the supraglottic structures are destroyed, and sometimes the the airway is narrowed, the stenosis of the airway, and in severe cases, there's complete and total obliteration of the airway. So these patients end up getting this tube, the tracheostomy tube, to be able to survive. Then we have the functional damage. The functional damage affects the two functions of the throat. That's for respiration and for swallowing. So children who suffer this functional damage, they will come with tube in the throat, that's tracheostomy tube, and then feeding gastrostomy tube that goes through the abdominal wall into the stomach. So they affect through that. And then some of them, the airway is spared, so they have only this tube through the abdominal wall into the stomach. That's a feeding gastrostomy tube. But then they equally have varying degrees of throat damage and strictures. And because most of these children are from poor homes, some of them also suffers malnutrition. Now let's come to the history. More than 100 years ago, you have these German surgeons, the Kelling and von Hacker. They were the first to describe the replacement of the esophagus, damaged esophagus with colon. And 50 years on, we have this great American surgeon, Joseph Ogura. He was the first to describe using the colon to reconstruct a damaged throat. And then we have the Saibhar Gupta, 1969. He was the first to use the stomach to reconstruct the damaged throat. So more than 50 years ago, great surgeons who are engaged in reconstructing the damaged throats have this categorical statement to say, and I would like to read that for you. And there are 4 categorical statements made by these surgeons, and after that I would explain that. There are a variety of methods devised to replace the hypopharynx and the cervical esophagus. A totally satisfactory technique to restore a destroyed pharynx is not available. Despite copious publications upon pharyngeal reconstruction following laryngopharyngoplasty, there are a few reports of pharyngoplasty without laryngectomy. Number 3, it is difficult to provide a reconstruction of the pharynx that will give normal ability to swallow. Restoration of both deglutition and phonation should be sorted, but laryngectomy is sometimes an inevitable necessity. So what are they saying? They are just saying that the dual function of the throat, when it is damaged, is difficult to restore. And sometimes you have to sacrifice one of them, especially the airway, for the person to be able to swallow well. And this problem is still hanging on us today. Now, what are the trends? What are the ways these throat problems are managed now? Most centers in the world, whenever you present with throat damage or throat strictures from caustic injection, the first thing they want to do is to find out whether this throat damage is dilatable or not. If it's dilatable, they try to dilate it because they want to avoid any form of reconstruction. Now, if it's not dilatable, then they have to reconstruct. And those that are dilatable, some of them, they have associated stricture of the esophagus. So the colon that you use to replace the esophagus, you can use that to connect the dilated pharynx. Then we can also use what we call the myocutaneous flaps. We use the skin and the muscle, to reconstruct the throat. We have the sternocleidomastoid myocutaneous flaps. I must acknowledge Professor Frimpong Boateng. He actually pioneered this surgery, and he used it to reconstruct the cervical esophagus and the hypopharynx. I learned that from him, and I used it in a couple of cases. And then we have the deltoid, where they use the shoulder muscle and also the pectoralis muscles and forearm muscles and skin to reconstruct the throat. You can also do combination. After you've done that, you can also connect your reconstruction with a colon. Then we have the enteropharyngoesophagoplasties, where the colon, the stomach, and rarely the ileum can be used to reconstruct the pharynx. That is where most of the surgeons that is what they use now. And a lot of them use the colon to reconstruct the pharynx. And that is what I am also using to do the job. So at the National Cardiothoracic Center, we have these patients, those who present with tubes, tracheostomy tubes and feeding gastrostomy tube, those who present with only feeding gastrostomy tube, presenting at the National Cardiothoracic Center. And the task for us to be able to get or to obtain a very good outcomes, we have decided to come out with this procedure that would eliminate the use of tracheostomy, especially in patients who have preserved airways. So we're confronted with a 16-year-old boy who had diffuse stricture from the back of the tongue right down to the neck. And the option is to, or traditionally what we often do is to bypass these strictures. But in this patient, we could not bypass anything because he had diffuse strictures all over. So that is what gave birth to the technique I called the colon flap augmentation pharyngoplasty. So we did use that, and it was very successful. And we did it for another 2 patients, and we're so excited about the results. So we published that in the Pan-African Medical Journal in 2015. Now, when these patients come, we try to determine the distal extent of the throat problem, throat damage with barium swallow. And those who cannot swallow, sometimes we pass an NG tube and introduce the contrast just to help us know the distal extent of this problem. So it helps us to know what to do for them, to design what we do for them. The suprahyocardial pharyngoplasty is what we started with, and it's still indicated in some of these patients. But what we have done, the innovation we have brought on is opening the entire pharynx. We open like a book, the entire pharynx. And then, this is how it looks. We open it, and you see that those who can identify the arytenoid notch there. And then we do our reconstruction. But before we do that, we measure the length of the pharynx we have opened, and then measure a corresponding length of the colon and open it at the antimesenteric border. And that is what we use to reconstruct the truth. And we do it so nicely. If you can just have a look at that. But the big challenge is trying to do this appropriately so that you don't have complications. No, so this procedure, this technique, has actually solved 3 main problems. And one, we were able to create significant space now. So our patients eat without significant aspiration. So we have solved that problem. That has been a problem for a lot of surgeons. Then the second thing is, there's another problem of reflux. When a patient swallows, the food hits the constricted part of the pharynx and reflux. That is, if you do a bypass surgery, where you try to bypass the strictured part of the pharynx. This problem was solved by a great French surgeon called Popovici, and he termed how he solved the problem as double pharyngocolostomy and Y. And this is how the picture looks like. So he did two anastomosis, one on top, one below, so that when the patient eats the food and it goes down, it doesn't reflux, but it will just find its way again into the colon. But what I do is to open everything and reconstruct, so we eliminate this problem altogether. Now, the third problem solved by this technique is using the scar tissue as part of the reconstruction. And another great surgeon, that's Amicia Chirika, he removes all the scar tissues before doing the pharyngoplasty. But we use the scar tissue as part of our reconstruction, and we've never had any problem. So what are the outcomes? We have done more than 20 patients who benefited from this reconstruction. There was no leakage, and there was no dysphagia in all of them. They all eat whatever they want to eat. one patient developed a reflux at night, which we sorted out because the mother was feeding the child late at night. And there was one patient who developed obstruction of the colon at the level of the diaphragm, which was also sorted out. There was no mortality. There was no mortality. So this technique has restored hope to many hopeless children. It's transforming lives. It's restoring smile on the faces of these ones. I must say that just about 2.5 months ago, we have 3 patients referred from Liberia. They were all children, all girls, 2.5-year-old, 4-year-old, and 7-year-old. And the 2.5 and the 4-year-old needed this technique because of the throat damage they had. So we operated on them. They are back to their country. They are doing very well. But then, 2 weeks after we discharged them from the hospital, we often, reviewed them. So the 4-year-old came to the consultant with the mother, and we had a routine, checkup and all that. But then in the middle of it, this 4-year-old was sitting on the lap of the mother, and I just saw that he jumped from the lap of the mother and straight at me and hugged me, 4-year-old. I was touched. I was like, what was running through the mind of this 4-year-old before she did this? But one thing I realized was, when they came, misery, well, when they arrived at the center, misery was written on the faces of these children and their mothers. But at the time they were leaving, it was all smiles. This is the impact we are making. And I must say that already this technique is attracting health tourism and all the advantages that are associated with it. Before I finish, let me just introduce you to this classification. These throat strictures are not classified. They've not been classified yet. But I think classification of these throat strictures will help us to categorize the lesions and prescribe the best solution or the best options for this solution. So I try to do something. It's yet to be submitted for peer review and possible publication. Because now that we know that they are dual function, or the throat has dual function, I try to group this classification into group A and B. Group A lesions are those affecting the larynx, and group B lesions are those affecting the pharynx. So group A lesions, AO, when there's no problem, A1, when you have supraglottic structures affected, A2, when in addition to supraglottic structures, you have stenosis of different degrees, and then A3, when you have complete destruction of the laryngeal opening. Then B lesions, they are describing the pharyngeal, strictures. B1, if it's a dilatable stricture. B2, if it is dilatable associated with esophageal lesions. B3, when it's undilatable. And B4, when it is so bad that the tongue is even stuck to the back of the throat. So you can have a lesion described as AOB1 lesion, a lesion described as A2B3 lesion, or A1B3 lesion. So, for example, A1B3 lesion is now the WHO has issued guidelines that when you have a patient with A1B3 lesion, you should not do that case without tracheostomy. But we can do A1B3 lesions with my technique without tracheostomy. And the A1 lesion is the one with the supraglottic structure destroyed, and B3, that's the undilatable type of throat damage. So, this is my last slide. This great surgeon, Mr. Chirika, he published a review article on caustic injection. This was published in Lancet in 2016. And the Lancet is one of the top journals in medicine. And under this, he has this to say, the management of caustic injection in low-resource settings. I'll just read through for you. In low-income countries, specific issues, including delays in management, limited access to medical expertise and technology, and poor follow-up, have a negative effect on clinical outcomes. These factors should be taken into account when planning management of caustic injuries in low-resource settings. Children are often involved, and esophageal strictures requiring repeat dilatations are the most common form of presentation. Introduction of complex endoscopic treatments and surgical procedures in the absence of a suitable hospital environment warrant caution. Under such circumstances, simple interventions, such as placement of surgical gastrostomy, should be favored because they might help avoid malnutrition and prolonged survival. I must say that Ghana has come of age, and we are a proud nation, and the black man is capable of managing his own affairs. Not about the economy, but about truth strictures. So on this note, I would like to introduce this young boy. He's 7-year-old now. We operated on him about 3 years ago. And he's doing very well now. I just want to prove to the world that this statement in Ghana, no, we are above that. We have found solution to some of these complex problems. This is how he came. He's not the same person though, but he came with a tube in the throat and a tube through the abdomen. But today, is Godfrey here? Great. So that's little Godfrey and the mother. No, you can stand there. You can stand there. And the mother, and the only problem I have with this boy is that he's not in school. He's not in school. He's a single mother, and taking care of him. And the mother has just finished a vocational school, and is now, I think, looking for support to be able to even look after this boy to go to school. And knows maybe somebody among the crowd will be touched to help this boy go to school. So this is a proof of what we have been doing. Now, my conclusions. I believe that as we sit here, thank you, as we sit here, innocent children have lined up just waiting for their turn, for disasters to strike permanently by this menace. Why am I saying so? Every month, from the statistics we have, children are ingesting this caustic substance. Are we, as a country, going to stay aloof, just watching this happen to us? I think our stakeholders must work assiduously, preventing exposure of the vulnerable in society to the accidental injection of this caustic substance, this dangerous caustic substance. We need to formulate policies and laws to regulate the import, packaging, and the sale of this dangerous substance, and educate the end users, especially the illiterate and the semi-illiterate mothers. I believe that this is an opportunity for Ghana, for this country, to take the lead in showing the way in managing this menace in the sub-region. Now, the WHO has issued guidelines not to operate on A1, A2 lesions without tracheostomy. I'm now using my classification. But then the National Cardiothoracic Center has taken the lead in finding a solution to this problem. That still poses a challenge to the surgeon, who is doing everything possible to restore the dual function of the pharynx, and the patient who is miserable and may never be able to swallow or breathe normally. I thank you very much for listening. Thank you. Thank you very much. God bless our homeland, Ghana. May I please acknowledge those who have made my journey what it is today. I would like to thank my late parents, Mr. Richard Tettey and Mrs. Charity Tettey, who invested in my life and made me what I am today. And let me acknowledge Professor Frimpong Boateng. He is the one who trained me. And he's the one, if I'm doing anything today, it's a reflection of what he did. And I would like to acknowledge Professor Andrew Anthony Ajay. At a point in my life, I found myself wandering in the wilderness and not knowing exactly the direction I want to go. But this man found me and helped me and offered me guidance as to how to manage my life. And I must say that even having the confidence to stand before you, especially before the Vice-Chancellor, is because of him. He has to encourage me a lot. Not only him, but I want to mention my big brother, very Reverend Dr. Adam Tettey. They have encouraged me and helped me. My brother from medical school has been my source of inspiration. Anytime I'm down, he's always there for me to encourage me. And not only him, I want to just talk about the entire family, my siblings, Sicho, Sister Kweni, Sister Kafi, and my niece and nephews. They have been very, very supportive. As a family, we love each other and we support each other in so many ways. And I want to acknowledge their support for me. And before I leave Professor Andrew Ajay, he's somebody who is so disciplined, very disciplined. And when you are in a committee where he is chairing that committee, you should be ready for discipline. He gives assignments, he will never forget that he's doing that assignment. He has a diary that he records everything inside. And sometimes he can call you at all times to find out whether the assignment he has given you, you've done it. And that discipline also has helped me a lot in my career path and all that. And because of that, we have nicknamed him Headmaster, because that is exactly what he does. Now, I want to acknowledge Professor Edwin. He is the Dean of the University of Health Allied Sciences, the Dean of the Medical School, University of Health and Allied Sciences, we started like twin brothers in research. And by the grace of God, we are what we are today. And I thank him for the support we have for each other. And at the end of the day, the others also join in. And we have achieved a lot as a center. I would like to also acknowledge Professor Cleglamte. As a head of department, he was so supportive. I must say that anytime I had challenges, issues, I ran to him. He always offered a good counsel and guidance. And that's what made me a successful head of department even now. Professor Cleglamte, thank you very much. And I want to thank you, the Center, National Cardiothoracic Center, for your support. And I must mention Professor Anita. He also came out with an innovative way of ventilating this patient after surgery, how to take care of them in the intensive care and all that. They have helped and supported this journey. And I want to thank all the doctors, the nurses, theater, ICU, the ward for their support to make sure that this program we have becomes a success. And I would like to thank my dean, Professor Yossen, for his support and encouragement, the provost of the College of Health Sciences, and the Department of Surgery for all their support for me. And of course, my church. They've all been supporting me in every way and encouraging me in every way. My pastor, Reverend Ajove, They called me and prayed for me. And I want to thank my former pastor, Reverend Freeman. He was here on Monday to witness the exhibition. And I was so encouraged when I saw him. And thank you all. My moderator is here. They all encouraged, prayed for me, and helped my spiritual development. Thank you all for your support. And the last, not the least, I want to sincerely thank my lovely wife and my daughter. And I do not want to talk too much, but just to summarize, to thank her for the environment he has created for me to flourish and be what I am today. And Salom, thank you very much. You have told me that you are not too careful about what I'm going to say. You don't even want to understand. All you want to see is to see me on the podium. That's all you want to say. But you've now seen it. So I thank you for the support. And I would like to thank the university for this opportunity. It's a rare opportunity, and I want to thank the Vice-Chancellor and the university community for this opportunity to present this evening. Thank you.
Indeed, our distinguished lecturer deserves another resounding round of applause. I think we've all been renewed in our thinking about swallowing, the effects of swallowing, and what can affect swallowing, as well as the functions of some of our internal organs, such as the pharynx. Thank you very much, our distinguished lecturer, Professor Tettey. We are very grateful. I would like to announce that we are live on Radio Universe 105.7, as well as all the university's social media platforms. And we are going to have more engagements on our platform, our radio station. I will give you further announcements on that. For this time, I would like us to relax as we take a performance by the Ghana Dance Ensemble. The Ghana Dance Ensemble presents to us the Gahu dance. I think some of us here understand Gahu. Gahu simply means money dance. This is a social dance performed by the Eves of the Volta and Oti regions. The dance was influenced first by the Eves' interactions with Nigerians in relation to costuming during their migration. Secondly, it took on linguistic and movement elements from Togo and Dahomey, present-day Benin. Hence, the presence of French language with a heavy Ewe accent. The dance starts slowly with singing in a procession style and graduates into a vibrant and throbbing music with energetic movements in response to the drums. The dance teaches collaboration and networking. This dance has been chosen for tonight's lecture, first to mark Prof. Tettey's heritage. Secondly, the dance reflects the rich knowledge Prof has gathered through hard work and collaboration with colleagues on the continent and beyond. This is to say that collaborations in whatever form leads to the success of all involved. Distinguished ladies and gentlemen, I present to you the Ghana Dance Ensemble in the Gahu dance.
Bonsoir. Ah, bonsoir, merci. Comment ça va, merci. Bonsoir, bonsoir, merci. Comment ça va, merci. Bonsoir, bonsoir, merci. Comment ça va, merci. Bonsoir, bonsoir, merci. Comment ça va, merci. Gaou salam alaikum. Gaou salam alaikum. Gaou azwajijon. Yo babi doan kagba mechaji na zonlio. Yo ba formali na gama wezo gbozonle. Gaou wa dogbe na mi. Eya. Gaou wa dogbe na mi. Àwọn no we. Je m'appelle Nawoto. Good morning, sir. Kilori Tofumi. Kawazo Adada Simiando Nala Kwela Bahunwe. I am very glad to Gaumbiao. Where are we going? We are going to Akumase. Appiah return. We shall return on Monday. 7:30. I am very glad to Gaumbiao. Where are we going? We are going to Akumase. Appiah return. We shall return on Monday. 7:30. Easy way. Easy way. I go. Aya. Mara kwa broga na ere bagude ko mai ma wodo ama electric ba honyama mai ma wodo ama electric ba honyama dona la gute ga broga melio mara kwa broga na ere agude ko mai Dona la kutega ka buroga mali umare kwa buroga na ere bakute ko mai Dona la kutega ka buroga mali umare kwa buroga na ere akute ko mai o mai ma wodo amaga la digi ba konyama mai ma wodo amaga la digi ba konyama dona la kutega ka buroga mali umare kwa buroga na ere bakute ko mai
So that was the Ghana Dance Ensemble from the Institute of African Studies, led by Dr. Aristis Hago. Let's give them another round of applause. And let me add that here at the University of Ghana, we know how to blend the arts and sciences very well. And so we won't invite you to just come and listen to talks from the sciences. We'll also give you something from the arts. My only disappointment, though, was that because Gahu is a money dance, I thought they would come sharing money. I didn't get any money. Well, distinguished ladies and gentlemen, we proceed with our program. Madam Chair, it's now time for presentations. But before we proceed with the presentations, please permit me to introduce some dignitaries that we have here. We are privileged to have joining us this evening Mr. Sam Okujeto, member of the Council of State. Thank you very much for joining us, sir. We also have here in our midst Emeritus Professor C.N.B. Tego, our former Vice-Chancellor. Prof, we thank you very much for inspiring us at our programs all the time. Also with us here, we have Professor Kwabena Frimpong Boateng, founder of and the first director of the National Cardiothoracic Center. We are also here with Professor Fred Binka, former Vice-Chancellor of UHAS and former Dean of the School of Public Health here in the University of Ghana. We are also privileged to have been joined by Togbi Sri III. He walked in and was introduced by the lecturer. He is the king of the Anlo state. Thanks so much, Togbi. We are very privileged to have you with us. And then also we have Togbi Honameto Kaleji, who is chairman of Star Oil Company Limited. Thank you very much, Toby. We also have some members of the clergy. We have Right Reverend Prosper Jomeku, moderator of the Global Evangelical Church. And we have Reverend Dr. Cyril Fayose, General Secretary of the Christian Council of Ghana. I'm told he's not here with us. We have Reverend Dr. Komi Hiagbe, Rector, Global Theological Seminary. So I'll move on to the presentations. As we move on, we will continue to acknowledge dignitaries that have joined us this evening. With the presentation, we are going to start with the College of Health Sciences, University of Ghana. Representatives from the college should kindly step forward. And let me give a little background as they come. Professor Tettey is the head of the Department of Surgery, which is located in the University of Ghana Medical School, also located at the College of Health Sciences. And so we are starting with the college. And we ask the Department of Surgery, UGMS, to get ready with their presentation. Department of Surgery, please get ready with your presentation. While the Department of Surgery is coming, we ask the School of Medical Sciences, KNUST, 1991 year group. If you are here, please get ready. SMS 1991 year group from the KNUST is on its way, and we ask the National Cardiothoracic Center, Kolebu, to get ready. We also ask the UGMS Research Committee and CHS Ethical and Protocol Review Committee to get ready. UGMS Research Committee and CHS Ethical and Protocol Review Committee, please get ready. So I'll step down at this time. The National Cardiothoracic Center has a citation to read in honor of our distinguished lecturer.
Distinguished ladies and gentlemen, this citation is presented on behalf of staff, management, and patients of the National Cardiothoracic Center. in honor of Professor Mark Mauto Tettey. This citation is presented to you by the management and staff of the National Cardiothoracic Center in recognition of your immense and selfless service. Since your appointment as Acting Director on 1st December 2022, you have demonstrated unparalleled dedication and made outstanding contributions to the center's overall mission. With your visionary and can-do spirit, you have inspired the staff of the center and fostered a culture of excellence, enhancing our capacity to provide exceptional services to our cherished patrons. Your enthusiastic, thoughtful, and sacrificial service have won the admiration of both staff and patients of the center. In your academic and professional journey, you have consistently exhibited a commitment to excellence in research, teaching, and service, mentoring countless students, aspiring surgeons, and the broader academic community. In recognition of these remarkable accomplishments, the management and staff of the National Cardiothoracic Center, with much gratitude and deep admiration, thus wish you, Professor Mark Mauto Tettey, a hearty congratulations on the occasion of the delivery of your inaugural lecture as a full professor of surgery, presented this 9th day of May 2024. Ayiko.
Thanks very much for the citation. And for reading it so well. UGMS Research Committee and CHS Ethical and Protocol Review Committee, are you ready? While CHS Biennial Scientific Conference Committee and Newsletter Committee stand by to make their presentation as well. We also invite Dr. Grace Abebio and Prof. Kwei's family to get ready. Okay, I'll step down now for her to read the citation.
Distinguished ladies and gentlemen, it is my pleasure to read a citation to Professor Mark Mauto Tettey on behalf of the Ethical and Protocol Review Committee of the College of Health Sciences. The committee is led by the headmaster himself. I read. Citation in honor of Professor Mark Mauto Tettey. You joined the Ethical and Protocol Review Committee of the College of Health Sciences by virtue of your appointment as the research coordinator for the University of Ghana Medical School in 2016 and have served on the committee till date. This citation is in recognition of your incredible work and dedicated service to the Ethical and Protocol Review Committee of the College of Health Sciences. Your unwavering commitment, expertise, thoughtful suggestions and insightful contributions towards the work of the committee have been invaluable. Your punctuality and regularity is commendable and exemplary. In instances where you acted as chairman, you steered the affairs of the committee and executed your duties diligently. Your exceptional efforts and devotedness to the committee is acknowledged and very much appreciated. Congratulations, Professor Tettey.
Thank you. Thank you very much. We implore you all, because time is not so much on our side, if you have a citation, you can display it and then we see the beautiful frame. Thank you. We invite Dr. Grace Abebio and Prof. Quay and family. UGMS Research Committee, please. A quick one. Zion Senior High School, 1982 year group. Are you here? Okay. So please get ready. I believe you are going to sing your anthem. Zion Senior High. And let me take this opportunity to announce that we are privileged to have been joined by PSEC Legon, Presby Boys Senior High School, Legon. Thank you very much. Thank you for the anthem. But please note that you were in a competition. We are going to declare the results. Our dance department will declare the results to you and send comments to your headmaster. We invite Global Evangelical Church Disciples Chapel to come forth. While the siblings, nieces, and nephews of Prof. Mark Tettey get ready. Siblings, nieces, and nephews, please get ready. Come. I think we have only siblings, and okay, I've seen one man. The last but not least on my list is the immediate family of Prof. Tettey. And so Dr. Mrs. Clenam Jeffy Tettey and the daughter should get ready. Thank you very much, Prof. Tettey. You can take your seats now. We are very grateful. We thank you all so much for your presentations. At this point, ladies and gentlemen, I'm privileged to invite our chairperson to deliver her closing remarks. Please let's welcome our chairperson, Professor Nanaba Appiah.
Thank you, Madam Director, and thank you to our lecturer this evening for enlightening us and for delivering a stimulating lecture. I think he deserves another round of applause. Well, after a lecture like this, I wouldn't attempt to give a summary. First of all, it's not my style. Second of all, you don't even try to do this as a professor of linguistics when you've had a lecture talking about the pharynx, the larynx, the esophagus, aerodigestive matters, and pharyngoesophageal issues. If you attempt, you're going to fall flat. But usually on such occasions, I pick up lessons. And so as we bring this lecture, or this ceremony to a close, I just want to share with you 4 of the lessons that I picked from today's lecture. The first one is the positive effect of good leadership, mentorship, and sacrifice. Today, we all came here to celebrate and to listen to Professor Mark Tettey. It's his day, and we are celebrating him, rightly so. But even as we do that, he himself has led us to pay tribute to Professor Frimpong Boateng for for his leadership in establishing the National Cardiothoracic Center, for sacrificing, for living a life of comfort to come back home and to serve his country and to serve humanity. So, Prof, we acknowledge you even as we celebrate Professor Mark Tettey. The second lesson I picked is the need for regulation and education. We learned that most of the patients that he's had to deal with are children, and they have had these swallowing challenges as a result of ingesting caustic soda. And this is because in many cases, their parents, particularly their mothers, were just making the effort to go by in life, to make ends meet. And so they are involved in soap making, soap and detergent making. But in so doing, they have exposed their children to caustic soda, and they have accidentally swallowed these. There's a need for us to have regulations regarding these, and also to educate these mothers, most of whom I believe are not very highly educated, as you mentioned, semi-literates and illiterates, to know that even as they go about doing the hard work to ensure that they put food on the table, the children, the vulnerable, have to be adequately protected. The third lesson I picked is that there's wisdom in our age-old domestic instructions. Remember, we're told by our mothers, if you are eating, you shouldn't talk, And some of us would want to have all the explanations why we shouldn't do that. Look, even if it is presented as mystical, as we move ahead in life and as we acquire more scientific knowledge, we then fully appreciate these. And so, you remember all the instructions, you don't sweep at night and all of those. Sometimes it's shrouded in some mysteries and so on. But eventually, we see the wisdom in all of these, and we do fully appreciate them, that they are all eventually for our good. But of course, there's the need for us to be more explanatory as we give these instructions to members of our household. And the final lesson that I picked is that innovation is not geographically bound. We've seen the work of Professor Mark Tettey and his colleagues at the National Cardiothoracic Center. I was impressed. I didn't know that I think I heard you say it's the only center that has been accredited in West Africa to train cardiothoracic surgeons. And that's because they have built a good reputation over the years. They have indicated that they can deliver. We have seen an example this evening of bringing back smiles to the faces of mothers and children, and also for restoring hope. What he has narrated here this evening, this ties in with a research mission of the University of Ghana, and that is to have global impact through collaborative research. Indeed, we do excellent here at the University of Ghana, and I would like to use this opportunity to appeal to the government and companies, first to support research and also to support healthcare. I can just imagine the cost of these surgeries, and I wonder how these parents are even able to afford these if they do not get support from philanthropists, from companies, and the state. My final comment is that there is amazing talent at the University of Ghana, and Professor Tettey is a clear example of such. Right here, yes, we can applaud for that. Right here in Ghana, through efforts from people like him and with adequate resources, we can really build world-class institutions. Thank you, Prof, for bringing smiles to our faces this evening. Thank you for giving us hope that indeed we can make it. Thank you very much.
Thank you very much, Madam Chair. We are also grateful to you for giving us a very good summary of the lecture and lessons to take home. Distinguished ladies and gentlemen, on behalf of our Chair and Vice-Chancellor, I would like to express our sincerest gratitude to you for responding to our invitation and joining us this evening to celebrate Professor Mark Tettey. We believe that you are going to join us in the subsequent lectures lined up for this semester. Before we file out of here, please let me take a couple of announcements. It's not characteristic to ask questions at inaugural lectures because it is believed that it's a full professor delivering the lecture, on a very well-researched topic, and the person is an authority, and so we don't ask questions. What he says, we are thankful to them, and then we take it home. But University of Ghana is very reasonable. We think that we should set a platform for people to address issues that they have, and so we have a platform on our own radio station, Radio Universe 105.7 FM, and this platform is called Knowledge Cafe. Knowledge Cafe, where the lecturer will be granted interview, and if you have any questions, you can call in for answers. The first one will be happening on Wednesday, 14th May, this coming Wednesday, 14th May at 11 a.m. So don't forget to tune in at 11 a.m. to Radio Universe 105.7 and join Knowledge Cafe to listen to our distinguished lecturer again. Now, an announcement on our next lecture. I'm excited to announce that the next lecture, that's the next inaugural lecture, will be delivered by Professor David Dodu Ahen, Director of the Institute of Applied Science and Technology at the College of Basic and Applied Sciences. And he'll be addressing the topic, Beyond the Limit, Engineering Sustainable Solutions for Basic Human Needs. I think we all need some little knowledge in engineering to be able to take care of things that happen in our homes. When you go abroad, people don't call plumbers and so on and so forth to come and deal with their issues. They deal with them themselves. So let's come the next time when we have the inaugural lecture. It will be in June, and we are going to circulate the publicity materials widely. So please watch out and join us for this lecture. For our order of refreshments, we have something for senior members set at the north wing of the hall, outside the entry there. So please, we are inviting all senior members and our special guests to have refreshments to my left. For students, we have refreshments for you at the forecourt of the hall. That's the AA Kwapong quadrangle, right in front. Our students who joined us from Presec, we are going to take a very special care of you as well. At this point, distinguished ladies and gentlemen, please let's rise for the university anthem. After the anthem, the recession will take this order. The platform party will recess, and the rest of us will join them row by row, and we'll take some more group photographs outside. Thank you very much.
Integrity to make our nation proud.